Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. In this series, we are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. We are talking about tummy tucks, and we have Dr. Brian Reagan here to tell us all about it. Dr. Reagan is a renowned board-certified plastic surgeon with Cosmetic, plastic surgery, and med spa in Corona Del Mar, California. Dr. Reagan has more than 2 decades experience in private practice. He trained at Cornell Medical College, the New York Hospital, and at the University of Texas at Southwestern in Dallas, the #1 rated program in plastic surgery. And I'm not sure if he'll share the details, but he was a part of the cast of The Real Housewives of Orange County, season 14. Hey, I'm Amy, and today we are here with Dr. Reagan, who is a plastic surgeon at Cosmetic Plastic Surgery and Med Spa of Corona Del Mar. How are you today?
Hi, Amy. How are you?
I'm doing great. So we've got some exciting questions to ask you before we get into the nitty-gritty. So first, why don't you tell me what inspired you to get into cosmetic surgery?
Well, the first step was deciding to be a doctor.
Okay.
And I knew that I uniquely wanted a doctor-patient relationship. In high school, I was the guy that a lot of the girls wanted to talk to. So I thought I was going to be a psychiatrist. And as I went to medical school, I was very interested in psychiatry and in aesthetics. I've always had an eye for the aesthetics. And just through my training, I realized that in plastic surgery, not only do I get to perform the creative side of surgery, and I like very much the immediate gratification of surgery and the technical challenge, but I get to practice a little bit of that psychiatry too.
Absolutely.
Yeah.
I'm sure all your patients come in with a lot to say.
They do, they do. And you know, the plastic surgery experience can be a very stressful experience for the patient. So that side of the experience is something I'm very interested in, and I take a lot of pride in taking time and getting to know my patients.
Right. When you're not working, what are you doing? What are your hobbies?
Well, I have a 10-year-old son, Riley. He's the best, and so I'm doing whatever he's doing. He's in baseball, and I'm cheering for him in the stands, or we're up in the mountains skiing. Yeah.
That's great. So speaking of your cases, is there one that is, say, more interesting or that stands out above the rest?
Well, patients like to think that we have a particular expertise. So they're always asking, what's your specialty? What kind of doctor are you? And I've challenged myself to answer that in a way that I'm comfortable with, because I like doing everything. So I've decided I'm the doctor of the wow.
The doctor of the wow.
Of the wow.
I love it.
The doctor of the wow is I want to take the patient on a journey where I really understand where they want to go.
Right.
And I want to develop that trust so that they'll let me get them there. And so when we're done, I want them to look at themselves and go, wow. So whether that's facial rejuvenation or a mommy makeover or even a rhinoplasty, I like the wow.
Okay. So if I ask you what's the most rewarding part of your job, that would be part of it.
Absolutely, it's seeing the satisfaction in those patients' eyes after they see what we've accomplished.
Okay. What's the most interesting place you've been?
The most interesting place that I've traveled to, I would have to say, was Istanbul.
Okay, why is that?
Yeah, it just was a magical, mystical city. I love history. And so there's tremendous history in Istanbul. It has been the center of 3 empires in the world. There's an incredible melting pot of cultures and religions and food, and so that was quite special.
Food is always good.
Yeah.
Well, I'm sure you've met a ton of celebrities doing what you do, but is there any you can kind of share about? Any experiences?
So I had the unique and fortunate experience to be on The Real Housewives of Orange County, season 14.
All right.
And that was great because I didn't know what to expect. And with those reality TV shows, you never know whether they're real or they're staged for the audience. And I have to tell you, it's real. It really is. Whatever you're seeing on camera, they really are that way.
Huh. We are going to get some insight from you as our expert today about tummy tucks. So,
Great.
right off the rip, what is it and why would someone do it?
So a tummy tuck is essentially you're removing some of the extra tissue. Often you get that when you have kids.
Okay.
Sometimes you get it if there's weight gain and weight loss. But you're doing two essentially really important things. You're removing extra skin and tissue, and you're tightening the muscles. So with pregnancy, for example, to accommodate the fetus, the tissue stretches.
Right.
And I don't care how good a shape you're in, you're never going to get that back fully, or it's very rare to do that. So one of the things that a tummy tuck can do is it can tighten that. And that not only looks better, but can actually help with support of the body. And then, of course, we remove some of the damaged tissue, and we can give you a nice flat stomach. And we spoke earlier about how I like to be the doctor of the wow.
Right.
And there are very few procedures that can really give you that wow than a mommy makeover. So a tummy tuck, some lipo, a breast aug, maybe a breast lift. We can do that in one surgery safely, and we do a lot of it at Cosmetic Care.
Wow.
And nothing gives that woman the wow like looking at themselves in the mirror and saying, wow,
Like
my
whole new
body's
body.
back.
Yeah,
I'm
yes.
back.
Dr. Reagan, do you perform any of these surgeries on men?
Absolutely. So obviously men aren't delivering babies, but we work with bariatric surgeons, and so we see men who have undergone massive weight loss, 100 pounds,
Wow.
150 pounds, and they have a lot of extra tissue. So sometimes we're able to just do a tummy tuck on them.
Okay.
And while they do not have a fetus stretching that tissue,
Right.
sometimes the internal fat and girth will stretch that tissue. So sometimes we do tighten the deeper layers. But without a doubt, we do tummy tucks on men, and we can get rid of that extra tissue. And guys want to look good too.
Absolutely. So is this procedure one maybe for someone that's looking to lose weight?
No. So it's very important. And we do work with bariatric surgeons. So weight loss is very different.
Okay.
And that should be under the supervision of a physician. We work with surgeons that will do bariatric surgery to help people lose weight, and that's life-saving.
Right.
Without a doubt. When they lose that weight, there's a tremendous amount of looseness of the tissue. Then they come back to us, and we will do, usually it's a little bit more extensive than just a normal tummy tuck. You know,
Okay.
so we're doing body lifts and arm lifts and thigh lifts, but there's no doubt that body contouring as a specialty is unique to itself. So we were talking about how does someone choose a tummy tuck surgeon? Well,
Right.
it should be someone that does a lot of tummy tucks.
Right.
If a guy does mostly, if a surgeon does mostly noses, then maybe that's not the guy or girl to do your tummy tuck.
Right. So, Dr. Reagan, can you kind of give us a little bit of insight between the difference of tummy tuck versus liposuction? Because I know parts of it are very similar, but it's also very different.
Sure. So liposuction is the process of removing fat, but you're doing nothing really to the skin. I mean, there are some things like laser lipolysis where you can tighten the skin a little bit, and we have other technology called Body Tight where you can tighten the skin, but liposuction is essentially removing the fat. With a tummy tuck, we're doing a lot more. So we are not only removing skin and fat, but we're also tightening the muscle underneath. And so we're really changing the shape of the body with that process. And so patients that come in that have just a little extra fat are great candidates for liposuction. Patients that come in that have hanging skin and maybe their abdomen is bulging from having kids, they're going to benefit more from a tummy tuck.
Okay. Who is a good candidate for a tummy tuck?
So a tummy tuck is a more involved surgery. For
Okay.
the most part, it's being done under general anesthesia. So the first thing is someone has to be healthy. We get preoperative clearance on our patients. We make sure they're healthy. They have to then have the extra tissue. If someone comes in and they just don't have enough to cut off, we're not going to do that.
Right.
You know, we're going to recommend something else. Maybe some tightening with the technology we talked about. Maybe someone will come in and they think they need a tummy tuck, and really you can get there with something less invasive, maybe just liposuction.
Gotcha.
So to answer your question, that's the expertise side of things.
Okay.
And that's where we always recommend that patients get 3 consultations.
Okay.
And even if they come to us first, I tell them, listen, go, you know, we think we're the best place for you, But go out and see what other people have to say, then come back.
Right.
Let's talk about it. The happiest patients are the most informed patients.
Of course. Of
Yeah.
course. Speaking of being informed, about how much does it typically cost to get a tummy tuck?
So a tummy tuck's going to run about $8,000 to $10,000.
Okay.
And often we're not just doing a tummy tuck. We're doing a little bit of liposuctions because we're looking at the body in a 360-degree fashion.
Okay.
Right? Like when you look in the mirror, you're just seeing 2 dimensions, but in real life, it's 360. So often I will talk about not only this, but we'll look at their back, we'll look at their flanks, we'll look at their bra line. And when you address that, then you'll get that patient to where they ultimately want to be.
Gotcha. If someone maybe doesn't have the $8,000 to $10,000 available, what credit options or payment options do you guys have that are available or that you recommend?
Well, we use CareCredit, and patients love it, and we love it because ultimately it allows us to do more of what we love doing,
Right.
which is cosmetic surgery.
All right. How does someone out there that has made the decision that they want to move forward, but they need to find a surgeon, what advice do you have for them to seek out that perfect surgeon for them?
So I feel strongly that they should seek someone who is certified through the American Society, the American Board of Plastic Surgery, and is a member of the American Society of Plastic Surgery.
Okay.
And let's step back a second and understand this. We are the only surgeons that train in doing this kind of work. Now, there are other doctors that are not members of our society who may do a good job, and they may learn, and they may learn on the side, and they do that. All we're saying is we think we are the most uniquely trained to do your procedure. And the thing that patients have to understand is that surgery is it's a real process. It's a real surgery. There are complications.
Right.
And in our hands, 95% of the time, things go great. But you're wanting that expertise, not only when things go well,
Right.
but when things don't go well.
Right.
And that's when you need your doctor to know what he's doing, know how to take care of you. In the end, we'll get those patients there. But we want patients to know that surgery is a serious thing. And it's worth doing your research. It's worth choosing your doctor well.
Do you have any advice that when viewing doctors and going and meeting and doing consultations, are there any questions that the patient should ask maybe to help kind of get a better idea of who the surgeon is and his expertise?
Right. Number one, are you a member of the American Board of Plastic Surgery? And these things you can figure out online.
Okay.
Number two is how long have you been performing that procedure? Our training is excellent, but if you're just out of training,
Yeah.
then maybe you want to choose someone who's been doing a little bit longer.
Right.
Okay. Number three, how many procedures like this do you do? One of our strengths at Cosmetic Care is we have 3 surgeons, and between the 3 of us, we do just about everything. And one of the things I really like about our practice is it's a full breadth practice. We do everything. We do facelifts, we do rhinoplasty, we do tummy tucks, we do liposuction. And if there's a particular procedure that I think one of my colleagues has a little bit more experience with, I'll ask him. And we talk about patients together. That's one of the strengths of a multi-physician practice.
That's fantastic.
Yeah.
I'm sure everyone listening loves that.
Yeah.
What risks should a patient know about when considering this particular surgery?
So with a tummy tuck, probably the greatest risk, it doesn't happen very often, but the greatest risk is actually bleeding after the procedure. It's called a hematoma, and it can be a significant complication that might require someone going back into the hospital or going back to surgery.
Okay. Are there things that a patient could do to prepare for this type of procedure?
Well, I think the most important thing is that the office and the surgeon prepares the patient for surgery, and that you are meticulous with going over their medication, making sure they're healthy, making sure if they're on any medications like blood pressure medications, that it's optimized. So it's not so much what the patient can do, it's what the doctor and the doctor's staff can do to get that patient optimized before they do surgery.
Got it. Okay, so why don't you tell us a little bit about how the entire procedure is performed?
So a tummy tuck, the patient comes in the morning, we review the procedure, we get to draw on them with those markers. They go to surgery, they're put under general anesthesia in our practice, and everything is done sterilely, but there's an incision that's low, and so There are 8 unique things that I focus on.
Okay.
Number 1, I'm going to thin out this tissue. It's called lipoabdominoplasty. Number 2, I'm going to tighten the abdominal wall so it's nice and flat and it's not bulging here and lower here. So when you're tightening that, you want to make sure it's nice and even. I'm going to tack that tissue down. It's called progressive tension sutures.
Okay.
It's really important because those patients can now stand straight up. If you go on our Instagram, you'll see patients that are 1 day after surgery and they're standing straight up.
Wow.
And so that helps with recover. I'm going to give them a very natural looking belly button. I'm going to make that scar very low and symmetric so it hides in a bikini. I'm going to do liposuction on the side. So again, it's 360 degrees. We're looking at the body. So I want them getting back in that bikini and turning and looking and everywhere they look, I want them to be happy. Yeah.
I love it. So after the procedure, what should the patient experience and expect to experience during the recovery?
So in terms of advancements, my tummy tuck patients are getting off narcotics probably by day 3.
Wow.
Maybe even day 2.
Wow.
And this is a huge advancement over how they were recovering 20 years ago. And so I tell them, listen, the first week is real recovery, but we want them moving. We don't want them at home lying still. After 1 week, most of my patients, I don't use drains, and so they don't have to empty any drains. And usually after a week, my patients are good enough to drive themselves. So they need some assistance for about a week.
Okay.
After a week, they drive themselves. After 2 weeks, they can start to exercise. Back in the gym at 4 weeks.
Perfect.
And no restrictions at 6 weeks. They could jump out of a plane.
All right. So what about scarring, though, after the procedure? Does it fade over time?
So part of, those progressive tension sutures that allow me to tack this tissue down takes the tension off the scars. So our scars look so much better. They really do.
Really?
And then for those patients that have scars that we want to improve, we have lasers that can help with that. We do taping of the incision for the first 6-8 weeks to minimize the tension. So we're getting great results with minimum scarring. So remember, there's 5 reasons why patients don't do surgery. The first 3 are fear-based, and one of those fears is fear of scars. And so we show them wonderful results, scars that can be hidden, and they see what they can look like after having, because there's nothing greater than having kids, right?
Right.
And unfortunately, sometimes that really affects your body, and it's hard to be confident when you look and you see, the changes that childbirth can do. And so I think it's wonderful that we can get them back into looking great.
So you mentioned that there are 5 barriers, and 3 of them are based on fear. What are the other 2?
So I give a lot of thought into why patients don't do surgery, because they come in and I know what they want, and I would think surgery's the answer, but not everybody does surgery. A lot of patients don't even come in because they don't even consider surgery an option.
Okay.
And so in my experience, in talking to my patients, there's essentially 5 reasons why people don't get surgery. The 5th is money.
Okay.
They have a hard time affording it.
Absolutely.
That's 5th, and that's where CareCredit comes in. Surgery's a lot more affordable when they know that they can finance it and pay a little bit each month, okay?
Right.
The 4th is they don't have the time off. But our technology is evolving to make things less invasive with quicker recovery. We talked about some of the tightening devices, so I'm super excited about that. The first 3, 1 through 3, are fear-based. Fear of anesthesia. Well, a lot of our techniques now we're doing without anesthesia. Fear of pain. But now I'm seeing my tummy tuck patients recover after 3 days. They're standing straight up after 1 day.
Wow.
So when they see this, they realize, yes, I can go through that. Fear of scars. But again, our techniques are evolving, so our scars are looking better. Less tension on the scars. Lasers to help with the scars. So all of those things can be addressed. Our specialty is evolving to make things less invasive, less recovery. We've got great partner in CareCredit, so it's more affordable. And then those first 3 is really about the doctor sitting down and addressing those fears.
Wonderful.
Yeah.
Can the patients expect to have follow-up visits, and if so, what is entailed in those?
They can expect to become part of our family. So they're gonna come to Cosmetic Care quite often.
Okay.
The first week, probably twice a week. Second week, probably twice a week. Then on a weekly basis. Then on every couple of weeks. And we follow them out. And so patients become part of your extended work family, and you get to know them. You get to know what's going on in their lives. The great thing about Cosmetic Care is we have an extensive spa. And so after they heal through their surgery, they realize, oh, you do laser hair removal. Oh, you do something for the face, something for sun damage. You have skincare. So they never leave our practice.
They stay forever.
Yeah.
I know you kind of touched on this earlier, but what results can the patients expect to experience after it's all said and done?
I think in the hands of the right surgeon, and I think that we have that talent at Cosmetic Care, I think they can expect wonderful results. I think they can expect transformative results. And so for example, I have moms that say, I haven't worn a bikini since I had kids, and I'm like, you will be in a bikini. So the first step is, to me, to correct the things that have changed in their body. The second step is for them now to feel confident. And that starts, you see that. I get to share in that. And you see that after the first week or two, you're still focused on recovery.
Right.
But you start to see this transformation psychologically, and they look and they're like, man, I look good.
I bet that is so rewarding.
And then maybe the husband comes in and he goes, yeah, she looks good. So it's all intertwined. And we talked about how I really like the psychological aspect of that doctor-patient interaction.
Right.
That's happy psychiatry. You
I
know what I
love
mean?
it. Well, you're great at what you do. All right, so we're going to move around to a very quick lightning round. Just going to ask you a couple questions, this or that, and you just shout it out and let me know how you feel. All right, cat or dog?
Dog.
All right, hard top or convertible?
Convertible.
Surf or ski?
Ski.
Golf or run?
Golf.
Night owl or morning person?
Night owl.
Decaf or calf?
Straight calf. Yeah.
Do you shop in-store or online?
More online now.
All right, it's so easy. NBA or NFL?
NBA.
All right. Well,
All
thank
right.
you so much for your
Thank
time,
you.
Dr. Reagan. We appreciate all of your insight. We learned a lot about tummy tuck surgery from one of the country's leading board-certified plastic surgeons. If you are considering this surgery, we hope we've provided the information that you need to decide if you want to take the next step and schedule a consultation. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Freena with CareCredit, and I will see you soon.